Education Month, and in today's Your Health First, we are digging deeper. We spoke with a Sanford Health endocrinologist who tells us that cholesterol can be passed by genetics with what's known as familial hypercholesterolemia, more commonly called FH. It's a diagnosis which refers to individuals with very significant elevated LDL cholesterol or bad cholesterol, as well as an increased risk of early onset and coronary artery disease if it's not sufficiently treated, and you don't have to be old to get it.
Very important because it's common and because patients can develop cardiovascular disease at young age, typically in their 30s and 40s, and that's, very young age to develop heart disease. And the homozygous FH patient can develop heart disease at extremely young age. Some kids even develop heart attack at the age of 8 or 10. So, it's a very important condition to diagnose at early age. The guidelines, state that screening should start at the age of 2 if there's a suspicion that there's FH in the family.
The CDC says FH is a genetic disorder affecting about 1 in every 250 people. It also increases your likelihood of having coronary heart disease at a younger age. So if you have a family history of heart disease or FH, it is important to get screened.
If anybody has any symptoms suggestive of heart disease, at young age, and there are no other risk factors, that will be, somebody that we should screen for that. There are some skin conditions that can sometimes basically influence the screening for FH. Presence of lipid accumulation around the eyelids and the internal part of the eyelids or around the cornea. That can be suggestive if we see that in somebody who's young. Now there are some lipid deposits on the tendons of the hands or on the Achilles tendons in the leg. That can be very suggestive. If we see that in a patient, that will be almost diagnostic, especially if it's on the Achilles tendon. So thickening or swelling of the Achilles tendon because of the fat accumulation can be diagnostic of this condition, and typically we screen for that.
For more information on FH, just visit kxnet.com.